course, right now, COVID is making it a little bit more complicated for patients with kidney disease, of course, especially those who are already on dialysis. But at the moment, it's just not enough education. And when I say it's not enough education, I'm not talking about, the information that someone can Google and go online and find. I mean, boots on the grounds, people talking and giving education for those who can't read, do not have access to the internet, and those who have a hard time even comprehending things that they do read. And oftentimes, most of our communities here in the US, I'm not sure how it is there, is that we have blocks of communities that are disenfranchised, and they don't really have all the means and the understanding. And so when you have, I'll just take a group, just say a lower socioeconomic background, those tend to be the uninsured or underinsured. So they're not getting the information from their physicians or healthcare workers in a timely fashion. And some of them don't understand the urgency of getting that information. And now with COVID, our hands are tied. We're not able to do a lot of the health fairs and the screenings here right now. And so that has also taken a hit.
Okay, so from your own, my understanding, and we've talked before, I know, as well, and my understanding again is you come from a nursing background as well. So from that side of things, is that, and obviously you mentioned education is still warranted, needed, especially around those who are displaced or disenfranchised, like you mentioned. Is it an added worry to you because of you being from a nursing, from that professional background as well? I mean, is that something that you would find additionally frustrating because you want to be able to do more, but you just feel that there's just no the structure doesn't fit in place at the best of times? Is that something that comes across your mind quite a bit?
Absolutely. And so I am a dialysis nurse by trade. I've been a dialysis nurse for about 19 years now.
Wow.
And it's very frustrating. Even though I have very limited involvement as a dialysis nurse with CKD stages 3 and 4, of course, I see tons and tons of actual dialysis patients that would have benefited from having education prior.
Right.
Have either prevented or either prolonged them having to even come on dialysis.
Okay.
And what I found as a dialysis nurse is that a lot of the patients did not receive any education for various reasons. You have patients that are ill and they just finally get so ill that they crash into a hospital and learn they have kidney disease.
Yeah.
And you get very limited education while they're going through the process of getting a temporary access to start dialysis within a couple of days.
Right.
You have those that were maybe even followed by a nephrologist, but fell off for whatever reason.
Right.
And then nephrologists, their practice don't have a very efficient way to be able to bring those patients back in or keep up with those patients. Sometimes it's just lack of staff. And sometimes it's just, the physician is just simply too busy and the capacity is not there. And then you have those patients that knew that this was coming any day now, but they hadn't mentally prepared for it.
Right.
So no matter what you tell them, it's not computing for them because they haven't mentally accepted that this is what's going to happen to them. But a vast majority have not had the proper education when they were initially diagnosed in stage 3 or 4.
Okay.
And so then there was no precautions taken to change their diet, lifestyles, exercising, medications, anything that could either prolong or prevent dialysis from coming, or even for that matter, talk about transplant.
Oh,
You know, there
wow.
are a lot of patients that would benefit from that should be able to not even see the inside of a dialysis clinic, but to go straight from finding out they have kidney disease to
Yeah.
start getting worked up on the transplant list,
Yeah.
especially those that already have donors.
Okay. Okay. That's very important. So understanding then, it's basically, there seems to be a bit of a gap between those, and like you say, it's not just a gap between those that are at risk or suspect for, kidney disease, but also the timing of education is just not it's not getting there at the right time, and accessibility to it is a problem. Is it that the question, the follow-up is really so you mentioned like it sometimes that obviously it can't the physicians might not have time, or it's the fact that the maybe it's the patients themselves might um find it difficult to make appointments with them, or something like that. In that case, is there resources that patients can go to or find through signposting, for example, if they can't get it from the professionals who are meant to be there to give them that understanding. Is there additional or alternative ways that they can get understanding? And I'm talking about those patients who want to be empowered, for example.
Right. Yeah, there are a couple of avenues. So both of the two larger dialysis companies here
Yeah,
have programs for patients that are in CKD 3 and 4.
right.
They're free. But again, you have to go online to find these courses.
Okay.
So if you're not online to hear about those, or if your nephrologist, that office is not, aware of those resources, then they don't get filtered out to the patients.
Right.
And then there's also a couple of things, like myself, I'm a patient advocate,
Yeah.
and I work with patients, help them coach and consult them through the process, more so like a navigator.
Yeah.
Um, and then the rest is just, it's hit or miss unless the community has some kind of health fair or something is at the church or
Yeah.
at a rec center.
Yeah.
It's just not efficient ways to get out the information to people outside of the internet. The internet, it is a good source if you
Yeah.
know where the right places to go to look for it.
Yeah. Yeah.
Yeah.
So and you talked about like the different healthcare, a little, well, touched on it briefly on the different healthcare schemes, and that can be an impact, I suppose, on patient care generally. On that basis as well, then, how do we think, how do you feel or think patients uh, and professionals could work together, or is there a way that they could be working better together?
Yes, I think what ultimately it needs to start with, in my opinion, as a patient and a
Yeah,
nurse, is that there needs to be like patient input in like some type of patient peer resource
yeah,
or something, at the physician level, at the hospital level, at the dialysis clinic level, someone like peer mentors.
yeah,
Um, and then because a lot of times a patient can talk, well, nurse or physician can talk to a patient till they're blue in the face.
yeah,
Oftentimes it just needs to come from someone who can empathize with that patient or have walked in their shoes
yeah,
and that can explain things to them. It's kind of hard for a nurse. I use home dialysis for an example, to try to calm the fears of a single parent
right,
with two small kids that want to do home dialysis, and she's trying to figure out how she would do this.
right,
But you have a single mother
yeah,
with small kids that can talk to that patient and give her some tricks of the trade.
Yeah.
Some things that, the average person that has not lived that life would not be able to work through with that patient. So I think starting off, we just need more patient representation
Yeah.
with the people who are actually taking care of patients. So they can have a better understanding of what their patients need, what their desires are, how they want to live, and how they learn.
Okay.
You can't take, a PowerPoint slide and sit 15 people in a room and expect them all to be able to grasp and digest the information the same. Some people are very hands-on or visual, and some people can sit there and write notes, but have different ways to also educate people. But I think it starts with patient engagement is to start bringing in more people that are patients into these facilities and organizations to help map out things.
Yeah. Okay. No, that's very important. I like that understanding, because I'm still, I have my own experience and my own understanding, but I like to get that understanding from a wider perspective. And that on that note as well, what about where you mentioned like, for example, patient mentors. Do you think that there's a place for that sort of role, for example, where those people from that sort of background or have that understanding from, say, even a patient perspective, can go to the health professionals who should be more engaged and active around education, that they have these discussions and say, well, this is what is happening on the ground floor. This is how you should approach education. Is that something that you think discussions should be had between patients and professionals? And so, it could be like yourself, for example, and myself, for example, having a discussion with, a professional and saying, look, this is what's happening. What can we do to bring our understanding more grounded to the ground level so everyone has an understanding? Is that the kind of thing that should be happening more, you think?
Absolutely. And I think that healthcare organizations would see an increase in patient engagement, patient empowerment, and even the overall clinical outcomes for patients. Because again, when you have these peer-to-peer mentorships, so like here in the US, okay, the National Kidney Foundation and AAKP, they have those type of programs. But again, how do patients find out about those programs?
Right. Okay.
If they're not online, or if they don't even know that those organizations exist. And then what about patients who are actually on dialysis and are struggling? Most of our nephrologists are not equipped to diagnose or even treat, any depression, mental health, anything like that. But a lot of times we say this patient is not compliant, and it's really that they're depressed and they're just still struggling with this life change and this illness and this diagnosis. And so when you can put peer mentors in places like that, and maybe nephrology offices, and I'm not saying you need like 10 everywhere, but someone that when a patient is identified, or even maybe the practice is when they first start dialysis, or even before they start dialysis, or when they're first diagnosed with any stage of CKD, have them speak with another patient. As part of their process, as part of their journey.
Right.
So I do actually think those conversations should be had. They don't happen off as much as they should, because you don't have a lot of people like us in that space.
Right. Okay. So therefore then, obviously CKD itself, the disease itself, is a journey. It's like, from having, being diagnosed early, whether you're early or late, it's a journey, and it's a pathway. So on what I what I also want to get an understanding of is basically where you said it might not whether it happens in like a nephrology office or like in a consultation area. Picking up on that point, actually, we're in a time now where you know, because of what's happened with the pandemic, etc. Things happen more online, more so now than ever, I guess. But do you think like there's a population out there where they have, whether they're being diagnosed or they actually have CKD, do you think there's a population that still has a preference that they rather see someone face to face, and they feel that that is where they would get uh, like feel like there's more real understanding that way, versus, you know, doing things online? Is that something that is a problem in the US? I know in the UK it's very temperamental, it's up and down, people do have their
Right,
preferences,
right.
but the population with, you know, from the CKD population, because they have been in isolation for a while and shielding and all of that, do you think that, you know, there's still a population out there within the you know, those who have it, would want to go back and speak to their renal teams? Or do you think it's just like basically, you know, they want to carry on the way things are?
No, we definitely had that population that wants to be in front of their care team. We've had patients that did not want to do telehealth. They wanted to
Right.
come to the facility and be able to actually see. Now, whether it was because it had been isolation or that's just how they learn or that was their preference, it was a lot of different reasons. But even now, patients are open to coming into the facility. And then those who are not, of course, they do telehealth, but even the telehealth or something like this is more preferable to just picking up the phone and speaking to someone on the
Yeah.
phone, because people like to be able to have that connection.
Yeah.
And so at least if they can see that other person and they get that connection, and then they're more open as well. But it's
Yeah.
hard to get a connection on someone just talking on the phone and not
Yeah.
knowing who they're talking to.
I think also like people were, I mean, you know, in the UK, the I mean, for at least I would say in the early to mid 2000s, that time period, there was a
Mhm.
lot of you know, there was a deep understanding about the importance of having educational resources aligned with certain treatments and things like that that came with that sort of care. But that kind of that got lost, or it's not been, it hasn't coexisted as much as it should in current time. So is that the same? That's what it's been like in the UK. Has that been the same in the US? It's kind of
Yeah.
lost.
Yeah, it's up and down here as well because you have a breakout over here
Yeah.
and so this will shut down along with the breakout over there.
Yeah.
And so it's hit or miss. Now I will say though, we are seeing pockets, where they're really fully open,
Okay.
and so people are getting out and getting back in front of their care teams and different things like that. So it is improving. It's just slow.
It's yeah,
Yeah.
okay, that's good. So the one of the so you talked about patients and professionals working together, the
Mhm.
involvement side of things. What I wanted to also ask is, you talk about briefly on where patients feel disenfranchised a little bit. I wanted to pick up on that because I know it's a sensitive subject. It's still very sensitive here in the
Mhm.
UK as well. So um, you know, with that in mind, does that mean that you find that from certain groups of those who have CKD, there are like lower literacy levels, and the approach, they don't necessarily have the either it's the enthusiasm or they don't want to approach, you know, their healthcare in the same way as someone who wants to be proactive. Is that what is that the area of focus that you feel that more should be done, and where the disenfranchised could be basically omitted, because we don't want that. We want to be able to work on the same page, really. And you know, how do you think that could be done a bit better?
Um, you know, the first thing, so this is always the example that I give.
Yeah.
So kidney disease is the 9th leading cause of death here in the United States.
Right.
Okay? And the example that I always give is I think about the hospitals.
Right.
So in the hospital, you have, let's just say, a diabetes educator.
Yeah.
You have someone that is dedicated to educate new diabetics or patients who are admitted with diabetes about diabetes. As relevant as kidney disease is, and how many kidney disease patients come in and out of these hospitals on a daily basis, whether it's acute or chronic situation, there are not people in the hospital that are designated for kidney disease.
Right.
There's no one to go to their bedside and give them some education, because this is the first time they ever heard that, you know, their kidneys are failing.
Right.
There's no one to go to their bedside to talk to them about what to expect on their first day at dialysis, what to expect, period. We have people that present to dialysis that do not understand that they have to come here for 3 days a week unless they die or get another kidney.
Right. Right.
You know, and so that's an education gap, you know. So again, it just goes back to the edge where we need to do better is where these patients are being seen.
Yeah. Yeah.
You have patients that come in, they're uncontrolled, hypertensive, poorly controlled hypertensive and diabetics. Then we need to really start talking to them about their kidney function. Then what can happen if you don't get this blood pressure under control? What can happen if you don't get this diabetes under control? So the education needs to start where the patients are.
Yeah. Yeah.
That's it.
Yeah. Yeah. No, I think that's very important. And really, because obviously, if that's going to carry on being a problem, that's where we're going to see things like, I guess, impoverishment, poverty, you know, and all of the other things that come with it, and disparity just, you know, goes all over the place then. So the final thing I wanted to ask is basically, what would your kind of take home message be for you know, World Kidney Day 2021?
My take home message was just to be educated, to educate. I think as healthcare professionals, and even, you know, people like you, people that are other patients, we all have some type of obligation to get that information out to others. What the scale that we do it on, that's your own personal preference.
Yeah.
But that whole each one teach one could go a lot further.
Yeah.
And I think a lot of times, you know, people are diagnosed, or they just kind of deal with their illness in their own little silos, and they don't understand that there's, you know, there are support groups out there like your support group. You know, I have a support group. They don't understand that there are support groups out there. But again, if they're not on Facebook or social media, they won't know about these.
They won't know about it. Yeah.
So that's, you know, educate. You're in the physician's office. You're at your endocrinologist's office. You know, talk about diabetes and what it can do to someone's kidneys. You know, you're at your cardiologist or your general practitioner. Talk about it, and then have concentrated conversations and education based on those patients' diagnosis when you're a healthcare professional. And invest in those resources for those conversations and that education to be had. You know, so the root of it is that we don't have enough improper education. And so when you get someone that's in the hospital, they are diagnosed with CKD 3 or 4. And they're not giving any options. They're just, this is what it is, prepare for this. You know, you don't really, and if they're still in shock, or again, they're not in acceptance, they're not going to just take it upon themselves to go and try to research. Everyone is not wired like that. Well, let me go research what this is about. A lot of people in our cultures are wired to, this is what the doctor said do, but this is what the nurse said to do. But what if your doctor and or your nurse is not telling you everything to do? There's a deficit there.
That's very important. So I completely get where you're coming from on that. And from my point of view, is that it's almost like the very health professionals need to know about these groups, or support groups. I kind of work with them, and I think they do know. I mean, people have been, for example, everyone knows about Facebook, for example. There's no one in the world who doesn't know about it anymore. And therefore, basically, they would use that platform, to connect with families and friends, for example. And I am sure they know about, for example, self-help groups and support groups. So really and truly, I think from what you're saying, it's making really trying to see that they're integrating what they're doing and kind of working with those who are kind of part of those support groups, so care is better integrated, because that, I think, is a kind of a solution. Really, it's kind of where education, just like what you're saying, it becomes basic part and parcel, really, of the day-to-day of a patient's life course, really, through their disease. So yeah, no, thank you. That's really kind of hit home for me. I really enjoyed talking to you. We must do it again sometime. And I hope you fully recover as soon as you can. And on that note, I'll let you go. Thank you for that, April.
All right. Thanks, Shahid. Talk to you later.
Thank you. Bye-bye.
Bye-bye.